Hi, it's Kate here from enhancedfemalelibido.com, and I'm here today to talk to you about low female libido and some of the common causes and potential solutions. Now, low female libido is a real concern for a lot of women, and there are a lot of potential causes out there for this issue, and I thought that maybe we'd just take a look at some of those today. So what's the big deal? I mean, so what if you don't have a lot of sex drive? Well, this is a real problem for a lot of people. It can be really damaging to your self-confidence, and it can also have effects on your partner's self-confidence also, where they feel as though, perhaps they can't please you and can't fulfill the relationship. And the impact of both you not feeling good about yourself and your partner not feeling good about yourself is a real problem and can have such a damaging effect on a relationship. It can also just reduce your sense of satisfaction in life and your overall well-being. So it is an important issue for a lot of people. And what are the potential causes? Well, there are both physical causes and psychological causes. So we'll have a look at a few of these. In terms of physical causes, medications and drugs can contribute to having a low sex drive or lowered sex drive. Drugs such as alcohol, some pharmaceutical drugs, over-the-counter drugs, and illicit drugs can all have an impact. Now, there are two types of drugs that I've listed separately. They're antidepressants and birth control medications, and that's because both of those drugs actually have quite a sort of well-developed or well-known link between them and low female libido. So if you are taking antidepressants or birth control medications, it can be a factor in lowering your sex drive. So it is important, if you are taking those drugs, do visit your GP or your general practitioner, your doctor, have a chat about that sort of thing, just to see if there's anything that you can do there to maybe adjust medications. Hormonal imbalance is another physical cause of low female libido. Things like after pregnancy, after having children, you can find that you have a lowered sex drive. Menopause is another time when hormones are sort of wreaking havoc and can also cause trouble there with a lowered sex drive. Menopause can also cause some other physical symptoms like decreased vaginal lubrication and things like that, which really make enjoying sex more difficult. So that's another factor there. And also just the hormonal sort of fluctuations that occur with monthly cycles. Now, in terms of psychology, women in particular have a really strong link between their psychology and their libido. So issues like anxiety, stress, depression can have a really big impact on whether a woman feels sexual or wants to engage in sexual activity. A history of sexual abuse or sexual identity issues are another couple of causes which could impact upon libido, and relationship issues. It's really hard to get it on when you're busy sort of having arguments and not getting on well. It makes maintaining a strong sexual relationship really difficult. In terms of solutions, well, it is a really hard problem, a tricky problem, because, men have Viagra and they take a Viagra pill and that can do great things for them. But there is no real Viagra alternative for women. In terms of medications, some women can take testosterone, and that has been shown to contribute to improving sex drive in some women. However, it's not particularly safe for everybody and can cause a much higher rate of cancers and also heart disease. So it's not a safe and readily available and accessible to all medication. And that's why it's not sort of, dosed around for every man and his dog to take. In terms of behavioural therapies, well, you can visit a sex therapist or a psychologist to talk about issues and try behavioural therapies, but there's not always a behavioural cause. A lot of women are, willing in their mind, but they just don't, or they want to be willing, but they're just not. The drive and the desire just isn't there. Sometimes the physical responses to sex and sexual stimulation just aren't there, and that's really hard, and behavioural therapy may not necessarily impact upon that. Another thing with behavioural therapy, in terms of if you want to change medications and things like that, that's not always a recommended course of action. You have to obviously discuss that with your doctor, and sometimes there may be a circumstance where the medication that you're taking is more important, and it's more important for you to stay on that medication. So a lot of women turn to natural female libido supplements, and on our website at enhancedfemalelibido.com, that's what we do. We discuss a lot of the female libido supplements and gels and creams and things like that to see how women are finding those and whether they're useful. So Prevestra and Her Solution, for example, are two of the well-known ones that are out there. What we find with natural female libido supplements are there's a real lack of good formal clinical research available on those drugs, but those natural supplements, I should say, but there are a lot of anecdotal reports out there to read, some of them good and some of them not showing a lot of result. So that's it. That's our roundup. In terms of if you'd like to know more about low female libido and the various supplements available, then visit our website at enhancedfemalelibido.com. We can show you the best ways to purchase supplements, both in the US and internationally, and how to get the best deals over at our website. So come and check it out. Low female libido is a real problem for many women, and if you are someone who is suffering with this, then there are some things that you can try and do, and we suggest coming over, have a visit, have a look around and see if there's something that takes your fancy that you might want to try out that could work for you. Thanks for listening. Bye.